Mike Gibson here. I'm a professor of medicine at Harvard and an interventional cardiologist. The question that often comes up is, why am I still having chest pain after you put that stent in? Well, we call it the coronary tree for a good reason. It's just like a tree. You have the tree trunk, those are your main arteries, and that's where we put the stent in, was in that big tree trunk. But then you have the branches off of that tree trunk, and sometimes you'll get some spasm in those branches. And then finally, you've looked at leaves in the past. If you ever hold up a leaf, you see a million little tubes running through it. That's what you have in your heart. You have capillaries, the very, very small vessels that are finally delivering the blood to the heart muscle. Well, you call it hardening of the arteries. You've all heard that term. The tree trunk, the main vessel, can be hard, and we push that plaque aside and open it up. But guess what else is hard? The little leaves, the little capillaries downstream, they can develop hardening too. So even though you open up the main artery, the tree trunk, the little capillaries downstream, or the leaves, they're still hard. And what we see is about 40 to 50% of the time, they are still not working right, those little capillaries way down in the heart muscle. Inoka means ischemia with no obstructive coronary artery disease. Anoka means angina, no obstructive coronary artery disease. So as someone who fixes blockages, sometimes someone comes to the cath lab and there are no blockages. Now in the old days, we would just send them home and say, well, nothing there to fix, you can go home. What happened is people continued to have chest pain, or they thought it's all in their head. This is not all in their head. We are learning a very prevalent and common condition, particularly in women, where you're having chest pain without having any blockage of the artery. But then there's a second kind of heart failure called HFpEF. That means heart failure with preserved heart pumping. How can you have heart failure and your heart is pumping? The heart squeezes just fine. It is pumping out blood forward just fine. What's wrong then? The problem is the heart can't relax and fill up with blood. So it's stiff and it's not able to fill up the way it should. What is a device called counterpulsation, which squeezes your legs and forces more blood into your heart and teaches those little capillaries to release something that allows them to relax and dilate again. That's endothelial dysfunction. We can treat that with this new technique. Thousands of doctors around the country have treated over 50,000 patients with flow therapy at this point. With the right diagnosis, it can be used to treat microvascular dysfunction, stable disease with refractory symptoms, or HFpEF. That's a lot of your patients. So with the appropriate diagnosis, it is covered by Medicare, Medicaid, and private insurance. So we're not just here to add years to people's lives, we're also here to add life to those years. And that's what counterpulsation therapy with flow therapy can do.